Neurology Quiz number 50. What is rapid onset dystonia parkinsonism? This is a very rare movement disorder characterized by abrupt onset of parkinsonism and dystonia, often triggered by physical or psychological stress. Other names for this condition are RDP, RODP, and DYT12. It is inherited in an autosomal dominant fashion and is caused by mutations in the ATP1A3 gene located on chromosome 19. This gene is involved in the production of the protein sodium-potassium ATPase, or the sodium pump, which is critical for normal function of cerebral neurons. In some cases, no genetic mutation has been identified. The condition is rare and only 100 cases have been reported worldwide so far. RDP typically presents in childhood or early adulthood, but age of onset can range from 4 to 55 years. There is abrupt onset of dystonia along with Parkinsonian features such as bradykinesia and postural instability, and prominent bulbar symptoms including dysarthria and dysphagia with a rostral caudal gradient. Symptoms may develop over several minutes to 30 days, after which they stabilize. Onset is often triggered by physical exertion, fever, extreme heat, childbirth, and excessive alcohol consumption, or emotional stress. In some patients, there may be preceding mild dystonia and cramping in the hands before disease onset. In most cases, the disease stabilizes. Rarely, seizures, anxiety, and depression and social phobias have been reported. Diagnosis is based on sudden onset of clinical manifestations, the finding of low homovanillic acid concentrations in the CSF, normal brain imaging, and lack of response to dopaminergic agents. PET scans and SPECT scans show normal dopamine reuptake in the dopamine transporters. Differential diagnosis includes other forms of dystonia parkinsonism, such as young adult onset Parkinsonism, dopa-responsive dystonia, dystonia 16, and X-linked dystonia Parkinsonism. RDP does not respond to dopaminergic agents. Palatal deep brain stimulation has shown limited or no therapeutic effects. High-dose benzodiazepines and muscle relaxants may provide symptomatic relief. All known triggers should be avoided. Seizures, anxiety, and depression, if present, are treated with standard therapy.